Well, so much. I appreciate you being here. Weather's not so great this morning, kept me up kind of all night. The presenter that kicked this off this morning had such a great message of interconnectedness and interlocking care. And that's a great message to take into the remaining of the day. Sometimes it can be difficult to really know where you're at in the moment. What I mean by that is right now you went from waking up this morning, getting ready, thinking about what you're going to do, come here, figure out where you need to go to the main speech, come here. Sometimes our mind doesn't quite catch up with our body. So why don't we just for maybe a minute or so really just take a second to focus. There's this kind of ancient practice of reverse thinking where you think backwards throughout your day. Oftentimes it's helpful at night when you're trying to go to bed if you can't, if you're feeling restless. So right now it's 9 a.m. It's 9 a.m. and you walked into this room, you sat down, you're talking with one another. We're starting a presentation. Think about what you did just an hour ago. So 8 a.m. You can start releasing some tension from your shoulders if you have any. What was I doing at 8? From 8 to 9. Just thinking through that, visualizing it in your mind. Maybe getting out the door, making sure you don't forget anything. We can work backwards from there. What was I doing from 7 to 8? From 7 to 8, what was I doing? Visualizing it clearly. Releasing some more tension, maybe from our mid-region, our legs, our calves. Maybe even earlier, 6 a.m., 5 a.m. Maybe some of us were sleeping. Maybe some of us were fighting the weather outside and we're waking up at different times throughout the night. So now that we've visualized that, we want to grow into acceptance where we're at in the moment. You can look around you. We're in this room together. There's people around you. Maybe you know some of them, maybe not all of them. You're maybe comfortable in your chair, maybe not so comfortable. You can readjust yourself. So now we're here. We're present. So I'm Geries Shaheen, and I am a performance improvement specialist. I also have a private practice called Pioneer Counseling. And today I'm just going to share a little bit about mitigating school stress in a post-COVID world, some school anxieties. Throughout this hour, feel free to step out at any point. You can interrupt me at any point if you have any questions or thoughts. You could also wait till the end Q&A, totally your call. Out of curiosity, how many of you here are therapists or counselors? Okay, quite a few. Any of you work in a school setting? Okay, great. My anxiety just kind of went up a little bit. Yeah. And any of you work directly with families and students? Perfect, awesome. So a lot of this information is going to ring true to you, and maybe you can carry some of this forward. I'm going to try to gain a lot of knowledge from you all while we're here as well. So I'll give a little bit of an intro. Caitlin, she's not here, but she's part of the Team of Concern with Preferred. So Team of Concern, you can find their website, a lot of information about how they connect with schools, in a very direct and accessible way, how their Team of Concern can connect with families just through a quick referral, can actually do home visits, can meet with students on site, a lot of direct care just through one point of contact if you're interested in learning more about that. So the majority of what I'm going to talk about today is in regards to anxiety in general, meaning what we see on a day-to-day with our students, with our communities. That's the presenting problem. That's how the community is presenting the deeper issues. So most of you are aware at this point of kind of what occurred yesterday and the heaviness of how that's impacted our community. Those events, again, whether it is a shooting, whether it is COVID, whether it's abuse, that is the presenting problem It's the difficulties of our society making itself shown, making itself known. And it is heavy and deep, and it can be a struggle to understand it. Not just from the client's perspective, but as a therapist, it can be difficult to sit with that and understand how this is being played out, what's happening. So part of this is getting the idea or understanding what is this anxiety, what is it about? It's not necessarily about the specificity of politics or even the last couple of years with COVID. It's about overall mental health. So these occurrences, this is not to discredit the impact of what happens, but these occurrences heighten the issue. And they make us more vigilant, more hyper-vigilant. We're more aware of it. How can we possibly fear something or feel for something if we don't even know it exists? How would we know that a sickness or an incident even occurs if we're not drawn to it, if we're not made aware of it? Both from a in the moment perspective, but also from a preventative care perspective. How would we even know they exist? So what we're going to do is we're going to connect. I would really suggest that you connect with a group of people you don't know and kind of manage or grow resilient in that anxiety. So we can couple up a little bit, or groups of 3 or 4, whatever you feel most comfortable. And we're going to use Menti. If you've never used it before, it's a really great tool. You can go to menti.com, and there's a code here, 39630183. I'll keep that up here. But we're going to look at 2 main questions. We're going to discuss what you feel like the biggest needs have been, or the biggest needs have been that you've ran into with your clients, with your families, with your schools, with your community. And then the second question is sharing steps that you've taken. Now, not so much collectively as an agency or organization. You as a person, how have you met these needs? What has helped to kind of process for your own self, and then to help with, or process with the person in front of you, the client in front of you? So we will take probably about 10 minutes, somewhere around there, to meet, discuss. You can share who you are, what you do, and then answer the questions. This is what Menti looks like on my end. So the cool thing about this is as you answer those questions, they will show up, hopefully, if I did it right. The answers will show up in a floating grid format. So again, the process, there we got an answer there already. So home issues, anxiety, lack of parental support. Awesome, I love these coming in. So again, the social component that we're really working on, the interconnectedness and the interlocking care, that's what we're gonna practice right now. So let's kind of direct our attention to those around us. Who do we wanna meet? Alrighty. Thank you all so much for meeting together and talking through these challenges and how you've met those challenges. You can feel free to either sit back where you were or stay where you're at. It's totally up to you, wherever you want to sit. You all provided a great deal of information here, an awesome amount of data on the challenges you faced and how you've met those. At the end of this presentation today, there's going to be a way where I can provide these answers to everybody. There will be a way that you can share your contact, and I can send this to everybody. So that'll be great. So some of the challenges that you listed: bullying, trauma, being kicked out of daycares and preschools, unstable home life, social media, ability to control their anger, home issues. So even as we look at these challenges, when we were talking earlier about that presenting problem, we're seeing the behavior, and even by what you've listed, you're starting to get an idea of what's deeper, what's happening deeper in the community, what are we picking up on. So some of the ways that you've responded: offering more virtual, individual sessions, listening, teaching coping skills, teamwork, providing individual support. We're still working through it, but involving families as well, so making kind of a wraparound care model. All wonderful, wonderful answers, and I appreciate you doing that. So steps that Preferred Family Healthcare took at the beginning of COVID, that's what I'm gonna start with. Steps that they took when everything kind of started going nuts and shutting down and everyone growing scared and fearful. How are we gonna get access to care? I was actually part of that team that said we need to move on a dime. We need to figure out ways to circumnavigate past barriers with consents. What do we need to include in consents to provide telehealth? Now it's, very common, but before it was brand new. What's the state going to say about these things? What's their definition of telephonic care versus, being on the camera? Just so many different questions being part of that team. So with Team of Concern, what they did specifically, not on a 30,000-foot view, but uniquely their team, they moved their service implementation outside when they could. They moved it to an environment area where they were able to operate, providing spring break and summer camps at parks, etc. Implementing virtual groups. We provided and built a landing page very quickly on the preferred website to say, here are all your virtual groups, not even necessarily ones that you have to go through a whole intake process. They're just open to anyone in the community online. You can join. I had the privilege of hopping into the entire region's virtual groups at any point and just seeing the amount of kids and families and individuals that would go in and out of these groups, virtual groups, was very encouraging. Added telehealth to consents, increased texting, phone calls, emails with friends and parents, that same wraparound care that you all are talking about, which was wonderful, but also we took a very cautious approach because it was brand new, especially with texting. Increased progress communications through all platforms. So progress communications is your classic progress letter to parents and whatnot, but we began to use more mediums, different mediums. So right now, Preferred and Burl, I've actually aligned and merged to be the nation's largest behavioral health network. And they're taking a lot of measures to provide very well-done marketing approaches on LinkedIn, Facebook, et cetera, trying to connect with clients where they are. So communications through all different kinds of platforms. Through a recent trauma-informed care seminar, there was a discussion about using things like care cards, simple images that you can send en masse to clients to say, how are you doing checking in? Rate the scale of how you're feeling with an emoji or something. Something to keep people engaged and connected. So TOC met in schools and began virtual as an option. The accessibility to care, community providers, liaisons, contact persons, directories, local agencies, they really tried to refer when they could because they realized they got overwhelmed. Low staffing, increased needs. There's no way you are going to be everything for everyone all of the time. That is something that we need to understand immediately. Both you as an individual and your organization will not be everything for everyone all of the time, but you can lean on each other. So connecting to the right level of care was incredibly important. If we're meeting with a client and one of the lists I saw earlier, one of the submissions was anger. If we're noticing that's a symptom, maybe we don't connect with an EMDR specialist in that moment because it might not have to do with trauma needing EMDR. Maybe it's anger management and we find an anger management specialist, someone that knows what they're doing there. So being a little bit more filtered when we're trying to find a referral. So with other lack of resources, we were able to connect to a specific staff type, our community support specialists. We would almost hold sacred the position of therapist or counselor to say, yes, we know you would probably be stellar at connecting with community services, but perhaps the community support specialist is the person to do that. So rather than overwhelm the therapy session with other various service types, you say that is just for therapy. If we're wanting to connect with other community supports, the community support specialist will do that. So being very, very specific on that. Prevention specialists, even before big anxieties, so preventing things before they happen, getting a heartbeat of your school, getting a heartbeat of these symptoms on a daily, on a weekly, maybe doing annual assessments, and I'll showcase a few of these here in a little bit of how you could do that. So they provided progress groups, What do those look like? Processing changes, processing quarantine, processing grief and loss. Very, very basic. It does not have to be complex. So the difference between process groups and progress groups. So with process groups, we're simply talking through emotions. We're connecting, we're sharing. With psychoeducation groups or progress groups, we're providing a skill, we're equipping, we're showcasing a theory, etc. So considering educational impact barriers or roadblocks to traditional learning, a lot of schools had to figure out new paths. How do we get these assignments finished? How do we get kids in their seats? How do we provide virtual? I don't think I've ever seen schools step up to the bat as well as they did in this area, where they said, we're gonna figure out how to make this happen, and we're still gonna provide stellar, as the best education that we can. And it took a toll on a lot of teachers. My wife is a teacher as well in a local school, and she had to figure it out. And there were nights where she was tearful, and she was crying, and she'd share that her team was also tearful and crying and not quite sure what to do, but they managed, they worked through it together. Considering the social impact, so loss of peer engagement, not just because we're at home, but literally loss of peers, loss of people in their lives. So social conflict, interactions in their stages of life, if we think of Erickson's stages, to try to kind of figure out what are they already going through, how does that impacting the virtue they're trying to attain. Considering the change of discipline models for lack of engagement, difference between in-person response versus video response, how do you discipline or how do you respond consequentially if someone is not present and they're not in proximity of you? They're going to care so much less, right? They're going to care so much less to any type of meaningful, consequential response. So that was another piece of it as well, trying to figure that out. Steps that we took during COVID: amped up connections to resources, offered more external referrals and community resources, banding together to string resources together, since many places were closing and did close or consolidated. Ongoing engagement was a struggle. Already engaged families were strong, but new clients or new referrals were more difficult to have strong connections. And excuse me if I'm reading the screen too much, a lot of this is Caitlin's piece of it, so I'm trying my best here. Clients that already were using virtual maintained and increased utilization. Clients that began virtual mid-COVID timeline had continued engagement. Some stayed virtual, others began to meet in person at schools. They had an extra empowered feeling, and they felt empowered through the ability to decide whether they're going to utilize virtual or in person. So that empowerment was really key, to say, not just to say, hey, we're going to flip the switch on you again, now we're doing things this way. We're saying now there's more options. There's things you can choose. Steps we took post-COVID. So we noticed an uptick in the need for social skills groups and integration. School counselors and administrators began requesting more social skills building to be implemented in sessions and groups. You got to think, a 3-year stint of a different type of socialization and trying to not backpedal, but integrate and figure out what that looks like. So part of this session or this presentation today was due to that specific request. We want to hear about how to do this or what's been done. So the program noticed client response to stress to be split. This is something to maybe jot down. Some clients appeared ambivalent to global and local events post-COVID. Others have big stress responses. So some normalize the idea of global and local traumatic events or changes. Others had a very big response to them, very overwhelmed, this kind of vicarious trauma, if you will. So yet others are overwhelmed by personal stress, their own personal fable story, what's going on in their world, and not very concerned with global events. Oh, it's just another thing that's happening. I don't need to really think about it. I can maybe easily avoid it. So continuing to offer all formats for counseling, in-person, virtual. At times this feels maybe too easy for clients, so families have become somewhat disregarded or informal. So in certain situations, it's so accessible, which is not a bad thing. It's so accessible that maybe it feels not as important. If I can access something or get something immediately, I can maybe not show up as easily. So some case studies. I'd like to share with you a few case studies, both from my private practice and one from Preferred, if that's okay with everybody. Okay, awesome. So the first case study, client X, their parents presented this adolescent with fear of returning to school post-COVID. Initially started with remote learning and eventually discontinued altogether. Probably a story you've heard. Did not return to school for 3 months. So the initial session. Is school difficult for you? Not overly difficult. Do you have peers? Yep, I see them outside of school now. Is there anyone at school that you fear? Trying to get an indication of fear-based thinking. No, I like the teachers. Through an hour of clarifying questions, the source was, I don't understand what is expected of me at any given point or at any given time. That is stressful. I don't feel I'm comfortable or competent enough through these changes. This is post-COVID, returning back to normal or regular or whatever that is. So not even at the brunt of like a worldwide change, but rather integrating a newness. So the deeper essence, it's not how do we get our students back in their chairs or back in school, it's how do we increase comfortableness, competence, understanding, and help through stress. That's a much different, more specific take. Session 2, full hour of CBT and Rogerian framed interventions. Client grew more confident, hitting on that competence piece, with returning to school. We're not saying go back to school. We're saying, hey, look, you're going confident and thinking about going back. Session 3, so 3 sessions every other week, once every other week, ended up being the final session as client had returned to school full-time for a month and began meeting with psychiatrists for mild anxiety meds. So we found a need, an extra need with some medication. So here's a little tip, request that there is a release of information or consent so mental health professionals and teachers can work together. Teachers and therapists, you're in this season of time in our society where you're having to be innovative in the mental health world. No one ever said, hey teacher, you're gonna have to consider the mental health of students, numerous students as a whole. No one ever taught that. So it's not necessarily placed on you, but to carry that message forward. And legally speaking, there has to be some sort of agreement or some sort of consent to do that. Case study number 2. Everyone feel like we're good to go to the next one, second one? Okay, perfect. So client X parents presented this early adolescent with fear of returning to school post-COVID, initially started with remote learning and eventually discontinued altogether, did not return to school for 1 month. This first one was 3 months, this one was just 1 month. This client, however, had a history of lacking in-school advocacy. They felt like the school was not advocating for them in a lot of different areas. Didn't feel heard, didn't feel connected. Initial session, is school difficult for you? Not overly difficult. Do you have peers? Yes. I talk to them online now. Okay. Is there anyone at school you fear? Nope, teachers are fine. Are you fearful of getting COVID? No, but my parents are. Through an hour of clarifying questions, the source was, I fear I will not be able to catch up. I remember what it was like before COVID. I don't want to go back to that. I was also bullied. I can do the work, but it feels like it's for nothing. There's no point to anything. It's not pointing to anything really meaningful. So I just don't do it. I don't feel I'm comfortable or competent enough through these changes. Okay. Session 2, full hour of CBT, Rogerian framed interventions, client grew more confident with trying remote again. a little different here. Session 3, full hour of CBT and trauma-focused interventions. We discovered a few things. Client decided to start remote and agreed to meet with the school counselor. Points of connection. Session 4, scheduled first day back to do a test day, just to test it out. Session 5, validation and praise and repeat. Maintain reintegration for more days. Session 6, normalized normative school stressors versus other types of stress. Total timeline, this took about 3 months to do for 1 month of not being at school. So sometimes the story is a little bit longer than what we feel comfortable with. Give you a second to process through that. Okay. Ready with the third case study? Perfect. Client X presented with anxiety about attending school and navigating peer relationships. Client reports specifically struggling with being bullied by his peers at school. Client still attends school regularly, but is often checked out and struggles to engage in class in the overall school environment. Initial session, is school difficult? I don't really like school. Do you have peers? I don't really get along with kids at school. Is there anyone at school that you fear? Not really. Excuse me. Through an hour of clarifying questions, the source was, I don't feel supported at school. I always seem to get in trouble when I stand up for myself. I'm constantly anxious that someone is going to mess with me or to try to fight with me. Really take in these anecdotal examples. Really try to live these out. Session 2, full hour of EMDR resourcing and grounding techniques to reduce anxiety. Session 3, process peer relationships and conflicts with peers at school. Utilize CBT interventions to challenge and replace anxious thoughts. Session 4 and continue to practice grounding and replacing thoughts until client feels more confident and comfortable at school. So another tip here, utilize grounding techniques regularly to help client feel safe in school environment before jumping to address the anxiety. We don't necessarily have to go immediately to what's wrong, what's wrong, what's wrong? What is the source? What's happening? It can be routine, consistent, trustworthy grounding techniques that a lot of people can practice on a day-to-day. My apologies, I think we skipped the tip from the last one. So the tip for the last one, be flexible and consistent, flexible in understanding and interventions, consistent in the message or the school voice. What is your school voice? What's your school voice, your classroom voice, your message about mental health? Okay. So some statistics. This is from ScienceDaily.com as of June 2022. From University of Michigan, children in remote school faced more sleep, behavior, and social challenges. Not a shocker. Researchers compare experience between families whose children were in person, remote, or hybrid school a year after the pandemic began. So this is more elementary school age children and talks a little bit about high school as well a little bit later. So elementary school age children enrolled in remote learning experienced greater behavioral learning, sleep difficulties, etc. A new study. The analysis shows that the impact of the pandemic K through 12 was significant, leaving students on average 5 months behind in mathematics, 4 months behind in reading. The pandemic widened pre-existing opportunity and achievement gaps, hitting historically disadvantaged students the hardest. Students in majority black schools ended the year with 6 months of unfinished learning. Students in low-income schools with 7 high schoolers have become more likely to drop out of school. High school seniors, especially those from low-income families, are less likely to go on to post-secondary education. And the crisis had an impact on not just academics, but what we're talking about today, broader health and well-being of students. More than 35% of parents very or extremely concerned about their children's mental health. I'm not really sure why that says only 35%. Honestly, I feel like maybe 100% of parents feel something, some sort of way, some sort of concern. So the fallout, thanks to concerted efforts by states and districts, the worst projections of learning outcomes this past year have not materialized for most students. However, students are still far behind, not where they need to be. Left unchecked, this is the thing I want you to focus on here, left unchecked, okay? because that's a call to responsibility. Left unchecked, unfinished learning could have severe consequences for students, opportunities, and prospects. In the long term, it could exact a heavy toll on the economy. It's not too late to mitigate these threats, and funding is now in place. There's money, so many places there's money right now for mental health. Mental Health America just said that they were awarded $3.5 million just in one day, just the other day. Here's $3.5 million, see what you can do to help, the mental health pandemic. Okay, so let's talk a little bit about resources and ideas. You may have these already, but I'm going to run through a string of them. Mental health first aid, are you part of that? Is staff trained in that? Do teachers know about it if they want to be part of that? They want to take it? NAMI, Missouri, teens need our help. Bring mental health education into the classroom with NAMI ending the silence. Preferred family healthcare online services. So we're looking at community agency, private practice engagement, streamlining referrals, mental health access, tele-check-ins with students that are struggling to return, training teachers in youth and mental health basics. That could be a couple. Some more ideas. Screening for mental health. Does your school do this? They probably do. Maybe they don't. Annual school mental health assessments for students, being proactive. Are you screening for substance? Are you screening for suicidality? Are you screening for mental health? So don't wait. There's no reason to not be asking these things. You can do this monthly, weekly, quarterly, yearly. You could have a scanner code to a form that's on your hallways that says, tell us how you're feeling today. You can go to a Google form or something, and every day you can get a sense of what's happening today. What's happening this week? This person says, not a big deal, but I'm feeling not so great. Been going through some struggles. You would have never known that. And it could have escalated each day with each comment from a respective student, or each stressor, each day going back to work or home, but you would have caught it early. So being able to differentiate between normative school stress and mental health dysfunction. That's where the threshold is for schools. You are not responsible for curing dysfunction or working to remove dysfunction. That's for another professional. But you can differentiate between what is a normative school stressor and when do I need to cross the threshold to connect students with respective care. So a few examples: the GAD-7, the DAP, the SABRS. These are all assessments that could be implemented. These are more formal clinical assessments that can be used by a clinician, or you can create your own type of form that just asks about symptoms or how people are feeling, doing a check-in. Resources, ideas, this was just a quick image of what that could look like. If you had these things around, maybe you already do. You are not isolated. Down here, there's just a map. So that's just PFH, not even with borough sites. The two right there on the bottom left, each little blue dot, those are locations. Over on the right, local private practices. A couple, agencies or just one person meeting with clients. Nonprofit organizations that work with mental health, all the booths in the other room. You are not isolated. It might feel that way. You are not isolated. Schools have all these resources and points of contact. You are never without a resource. Mentalhealth.gov, SAMHSA's national helpline, Access Crisis Intervention, United Way 211, free telephone counseling. There's a lot of them. I've equipped my 11-year-old, get this, I've equipped my 11-year-old on her phone. Yes, she has a phone. Don't get me started. But I've equipped her with New York's free mental health text-based services in New York. Why New York? Because there are a couple of the states that are most innovative in providing this stuff immediately. She goes in a room, 45 minutes. Hey, I felt like this today, went through these things, this stuff sucks, this stuff was really great. I can't believe that these kids said this thing. Kids can talk to anybody about anything, but this was to a listening ear, a professional service. She had immediate access to care to it. People seeking help, CDC people seeking help, crisis text line, text home to that number. BHR, Provident, the Trevor Project, SSM Health, 988 Lifeline, all these things are accessible. So we're at 9:45. We're gonna just take a quick breath. Maybe you want to drink some water. I'm gonna drink some water. A quick break as in like not going anywhere, but just 30 seconds to recoup and breathe. I'm about to enter another portion here to talk about a needs-based model. Alrighty. So the problem, the need, what are we talking about today? Well, Geries, we need to get students in their seats. We want them to come back. There's increased anxiety. Students are not returning to school. Okay, let's break it down. The presenting problem, increased anxieties, lack of student engagement, decreased school attendance, fear of returning. These are the presenting problems. We want to work deeper. Deeper problem, what are we learning from these anecdotal examples? Lack of belongingness, lack of connectivity, lack of resiliency, lack of confidence, lack of trust or feeling safe. You could be the safest place, the safest building, right? But people can still not feel safe with the environment that they're in. Lack of drive, motivation, lack of feeling that goal-driven sense. So the outcome then, we'll just look at the opposite, make it super simple. The outcome is belongingness. The outcome is connectivity. The outcome is increased resiliency. The outcome is increased confidence, increased trust, increased feelings of safety, increased drive, motivation, and a goal-driven perspective. So it's not necessarily decreased anxiety, but rather increased connectivity, which leads to decreased anxiety and increased attendance and increased safety. So we want to develop a re-engagement plan through meeting human basic needs of these things that we listed, these outcomes. So when COVID started, I had shared this with like a lot of people that I would run into. The community did what it felt it had to do to confront a widespread virus. No one's saying that's necessarily a bad thing. However, it's easy to train kids new habits. It's much harder to untrain them. Very easy through behavior modification or what have you to train a kid a new thing. They go into a new classroom every single year. They get retrained every single year. Training new habits is easy. Untraining is a lot harder. So some sources, belongingness, how did that get impacted? Social distancing. Connectivity, remote and virtual environment. Resiliency, low tolerance or lower tolerance to change, this shock, this collective trauma. Confidence, self-doubt to adaptability. Everything is changing. Not just a little thing here or there, everything is changing. Trust, lack of consistency over time. Drive, motivation, goal-driven. Guess what? I don't know what the future holds. More than what I didn't know before, it's an unknown. I have unknown futures. I go to a guidance counselor, I talk to my teacher. They have unknown futures now. If they're dealing with their stress, how are they going to deal with mine? If they're dealing with their unknown futures, how are they going to work with me on dealing with my unknown future? So that drive and motivation is decreased. So potential interventions, belongingness, social re-engagement opportunities, connectivity, let's incentivize connection. Resiliency, we can process trauma, exposure to normalizing traditional and routine experiences. That's why things like homecoming parades and proms, et cetera, are so helpful for communities. They are routine. A lot of families start off, for example, it's a community example of going to church. How did you go to church? Well, my spouse invited me. How did you go to this event? A peer invited me. Right? It starts off like that. You're normalizing exposure to traditional routines, things that are consistent. Confidence, healthy risk-taking, small doses of adaptability. You've had to adapt your whole life the last 3 years. I'm asking you to just adapt this one thing today, and I'm going to praise you for it. Increase that confidence, that competence. With trust, consistent routine message and experience over time. I tell my clients all the time, you want to build trust, it's consistency over time. Have your message be true time and time and time again. And if it has to waver or change, be transparent and open about it. Drive motivation, goal-driven, clear futures. Create some clear futures, student-specific, school-specific. Here's what our school is doing. Here's what you could be doing. Here's some options, some paths, some resources. That specificity will create very clear futures. So anxiety is a biological response to stress. Either redefine the threshold of stress or redefine the biological response to the stress. Cognitive behavioral therapy or resiliency building, all that clinicians, basic counseling principles that can be used. Anxiety has a purpose and a message. It may be informing the client to pursue safety, among other things. We need not be fearful when we see it in someone. You see anxiety in a student or a peer or a colleague, it's not something to be fearful of, but something to grow connected through. All right, we're going to speed things up a little bit. So potential interventions, belongingness, these are more specific tasks or measures. These are examples. These are not concrete. I trust that you can create much better ones than these. Belongingness, daily polls and school voice sent to those identified as struggling. Connectivity, pathway to relational experiences with student body and teachers or administration. It's a two-way street. Ask yourself both these sets of questions. Why should this school care about the kids? Yeah, but also why should this kid care about your school? Like, what are we offering them? Probably a lot, but from their perspective, what are they actually seeing? So as much as you think you know the answer to this question, ask your student body. Resiliency, provide access to process groups, cover the costs in their in-pocket care, counselor on call, etc. Cover the costs, meaning there's a lot of funding opportunities there. I'm not asking you to dig in your savings accounts and cover it, although there's been a turn of what I've noticed in employers covering the cost of mental health sessions for their employees rather than going through insurance, which has been really interesting to see. Kind of a rolling up the sleeves saying, I'll take care of my own employees and get it done. Confidence, turn attendance into app-based points. These are just ideas. There can be a lot more. Maybe they turn into gaming tokens, item stores, gift cards, used for other incentives, type of behavior modification. Trust, building a bridge, weekly text, email to students showing an update of what's going on in school, what's the school experience, those that are having difficulty coming back. After normal school hours, maybe ongoing open houses, opening your building up to more community events or causes. Having booths like this show up, pick a therapist night or explore how many organizations exist. So if we drive motivation goal oriented, utilize SMART goals. Everyone knows SMART goals. Make them focused on mental health. So an average person needs 9 touch points to get your basic level of buy-in. Radio, visual media, print, conversation, text, phone calls, home visit, billboard, peers, various events. Is your school message bubbled in regards to mental health and what you provide? Is it just there in those walls? Or does the community know what you do, know what you're about? So these are just ideas of being innovative. The ACA published an article. Medical providers are soon going to couple mental health assessments in each visit. Let that sink in for a second. I'm going to a medical provider. They're going to start coupling a mental health assessment into that experience. How are you going to respond to that when you're asking for a physical at a school? Oh, they're physically good, but also, interesting, they have this diagnosis. Also, they have a history of cutting. Also, they have this and that. All of a sudden, the physical is a lot more than just, did you get your, are you all up to speed on your visits and shots and whatnot? Being innovative, I've seen some private schools incorporating buddy systems, a buddy system approach. As a kid ages through the grades, they know they have a go-to buddy that they can go to for insight or just information. A kid usually a grade older, or a couple grades older, that is that person for them, their person. Being innovative, so live heartbeats, we talked about real-time monitoring. I'll skip that one. We're getting close to the end here. Being innovative, leaning on agencies to provide home visits, having class cards or e-cards to encourage students. Some of the PFH rural areas delivered person-cared packages during COVID and post-COVID to prompt engagement. Utilizing a student ambassador program, we've got the CAPS program here. I helped with the first group that went through that, but it is an incredible program. Imagine having a student ambassador program to instill a culture of change through mental health, the whole mental health group. So perhaps consider yourself a brand in that sort of way. So agencies, if you're an agency here, present, sponsor, make your presence, booth rotation at lunches, align with one another and let students decide who they want to pick. Lastly, we've got a couple minutes for Q&A. I will send you this resource list. If you want, you can scan that code, put your email, and I'll forward all this information to you sometime this week. That's the time that we've got. I kept you straight to 9:56. If you have questions, feel free to come up if you'd like.